Good evening, everybody. Thank you very much for joining us for our presentation tonight titled Accessing Independence with Community First Choice. Our primary presenter tonight is Kathleen Hayes, who is the owner and principal attorney of the office of Kathleen D. Hayes, LLC. Kathleen's practice is founded upon a platform of educating and empowering individuals with intellectual and developmental disabilities and their families. Kathleen's work is driven by a personal passion. Kathleen's relationship with her uncle, Danny, who has an intellectual disability. He taught her not only the beauty of disability, but also the incredible vulnerability, stress, and fear that families carry as they try to navigate a complex system that seems to plummet before every peak. She's going to be assisted tonight by Andrew Comero during the question and answer period. And without further ado, because I think that this is going to be quite a presentation, I want to introduce and thank Kathleen for joining us tonight. Tonight's format is going to feature questions being asked in the chat area. We're going to try and concentrate on the questions that get asked that are more or less general in nature, so it'll benefit the most amount of people on the call. And if we have questions that are a little bit more centered to possibly your own circumstance or the circumstance of someone that you know, maybe those can get taken up towards the end of the presentation if we have time. Okay? Kathleen, thank you very much.
Okay, thank you so much for having me, and thank you everybody for attending. I want to thank the ARC Connecticut for featuring this presentation tonight. It's one that I think we can't underscore the importance of enough. We titled this program Accessing Independence Through Community First Choice because this truly is a Medicaid program that can be a portal to supports and services for individuals, especially with intellectual disabilities that are otherwise accustomed to a waiting list for residential support specifically. So tonight we hope that this is a very useful presentation, especially for this group. We have tailored it to individuals with intellectual and developmental disabilities so that you can really see the practical utility of it. And with that, I'm going to share my screen. We do have closed captioning on the presentation tonight, so I will be pausing sufficiently for the purpose of hopefully allowing those subtitles to complete before I move on. Okay, when can you see my screen? Everyone can see it? Okay, perfect. Okay, so this evening's presentation will begin with a background on Community First Choice so that we can understand where it came from. I will then talk about the eligibility rules for the program. We will discuss the actual practicalities of how to apply. And we have some examples of CFC, Community First Choice, in action so that you can see some case examples of when and how this program has been successful. So a bit of background, and this is critically important even as we're several years, a decade out from when Community First Choice first became part of our world. It came to life as part of the Affordable Care Act, which, as we know, is a federal law which was passed in 2010. And what that federal law said, there were of course many components to it, hundreds of pages. It said states, all you states can choose to offer Community First Choice as part of your Medicaid program. We're going to really delve into what Community First Choice is, of course, but as a broad overview, it is a Medicaid program that provides a budget to individuals that meet the eligibility criteria to self-hire and manage caregivers and personal supporters. So the Affordable Care Act said, okay, we want to be able to encourage more home and community-based services. So states have the option now to provide community first choice as an option to their Medicaid recipients. 5 years later, in 2015, Connecticut said, we're going to take you up on that, and we're going to amend our Medicaid plan to include community first choice. So community first choice first came on the scene in Connecticut back in 2015. I start here and highlight the legislation here because it's important to remember and see that community first choice exists in Connecticut on two levels. At the federal level, meaning that it's connected to the life and vitality of the Affordable Care Act, as well as at the state level, meaning that we in Connecticut have a choice to offer this program. So from a perspective of legislative awareness and advocacy, a threat to the Affordable Care Act being overturned or possible changes in Connecticut legislation could potentially impact this program. So what is the Medicaid plan? Is, I know, confusing for so many people, and I attempt to break it down to the greatest degree possible and try to streamline it and make it accessible. So Medicaid is the health insurance plan in Connecticut for individuals with disabilities. And I'm sorry, it looks like my subtitles aren't working right now, so I apologize if that's intermittent. Can you still hear me? Okay, great. Thank you. Okay, so Medicaid is a health insurance plan for individuals that fit through one of three doors. So you see on the left side of the screen, there's a door, Husky A, there's a door, Husky C, and there's a door, Husky D. We're going to go into more detail on each of these, but Husky A in general is a source of health insurance for parent caregivers of children under the age of 18 who meet low income limits. Husky C is a source of Medicaid for individuals with disabilities and elders, people over 65 or older, who meet low income and asset limits. And Husky D is a source of health insurance for adults ages 19 through 64 who meet low income limits. So not everybody's going to fit through every door. Some people are going to be able to fit through more than one door. The point is, and I like to liken this to a game show, is that once you can fit through a door, I always think of those game shows where they say, do you want what's behind door 1, door 2, or door 3? In this case, all of the doors lead to Medicaid. So it doesn't matter how you get there. Once you get through the door, you can access Connecticut's Medicaid plan. And Community First Choice is part of the Connecticut Medicaid plan. So what is that? I'm going to bear down a little more. So we all, if you're employed and you have insurance through Aetna or Blue Cross Blue Shield, every time you enroll or re-enroll in your plan, you get in the mail a big packet that we probably all throw away or put in a drawer somewhere. If you actually look at what that booklet says, it has a list of all the different covered services. So health insurance covers, and I put a lot of these services here: dialysis, hospital visits, durable medical equipment. So all of these blue boxes here are different covered services under Connecticut's Medicaid plan. And you'll see Community First Choice with the star in the bottom right corner. Now, I couldn't just go to the hospital and say, I need dialysis, because it has to be medically necessary for me to get that service. The same is true of Community First Choice. I can't just say, well, I'm enrolled in Medicaid, so I can have Community First Choice. I have to otherwise prove it's medically necessary, which means I have to meet all of the eligibility criteria. So what are those criteria? Community First Choice, once again, is a state Medicaid plan option. So it's a covered service for any person that's enrolled in Medicaid for personal care assistance and related services. we're not going to speak so in such great detail about the related services tonight. There are things such as occupational therapy, physical therapy, or even home modifications. And I'm happy to speak further about that later on or through the question and answer session. We're really going to focus on the care assistance portion. And Community First Choice is available to individuals of any age who meet the 4 prongs of eligibility. The first, and we've been just speaking about this just now, is that you're enrolled in Husky A, C, or D. You have to be living in a residential setting, able to self-direct services, and you must require an institutional level of care. So we're now going to go through each of those criteria. Andrew, at this point, are there any questions that you think should be addressed at this time? I think you're on mute, Andrew.
No questions at this time. You're doing great.
1 second.
Battery 60%.
Sorry. No. Yep. No questions. You're doing great.
Andrew?
Yes.
Okay. Are there questions?
No questions. You're doing great.
Oh, great. Okay, good. Thank you. Sorry, my speaker cut out there. All right, we're rolling. Okay, so eligibility criteria number 1. Somebody must be enrolled in Husky A, C, or D. So I'm going to go through what those options look like and give you some general guidelines in terms of what the eligibility criteria are and how to apply. There's 3 types of Husky C. Can't be easy. Of course not. Why would it be? So the first is Husky C Community Medicaid. And what's important here is that for every single Husky C, in order to be eligible, you have to be a person with a disability, and that disability has to meet Social Security's definition of disability. And you have to be an elder, and you have to meet the income and asset limits. So this is typically where individuals with disabilities will access their Medicaid, but not always. So the first is through Husky C Community Medicaid, which has very low income limits. You'll see $874.38 for most of the state, a little bit higher in the southwestern portion, and there's an asset limit of $1,600. I do want to say one thing here because it might be of benefit to some individuals participating, which is that individuals that are accessing community Medicaid might be accessing it with a spend down, meaning you have to pay for so many medical bills before your Medicaid coverage will kick in. You can use a special needs trust to access your community Medicaid without a spend down. So I just put that there as kind of a public service announcement. W1E refers to the application. So if you go to the Department of Social Services website for Connecticut, that's the Connecticut Department of Social Services, the W1E is the actual name of the application for Husky C Community Medicaid. It's also the application for food stamps and other cash assistance programs. So you complete the application and they filter through what you're eligible for. Husky C also offers Medicaid for employees with disabilities. You'll see it's the exact same application. The main difference here is that this is someone with a disability who's employed. And all that really changes here is that because somebody's employed, they get to access Medicaid with higher income and asset limits. So you'll see the income limit, which equates to $75,000 a year, and the asset limit of $10,000 plus retirement accounts that are exempt.
Hi, Kathleen. I'm just going to jump in and interrupt. So we've had 2 questions, and if you could just address it simply, and that is, the idea is that there's an institutional level of care, which Linda Ramler pointed out, that no one needs, right? But then you're able to self-direct. So the question is, it seems counterintuitive, right? That you need an institutional level of care, but then you're self-directing. So maybe if you want to explain that, or I think you'll get to that on another slide as well. But I just
Yes,
want to
so
let you know, we got 2 people
Thank you.
who've asked that.
Perfect. So I will, so we're only on the first step, which is you have to be enrolled in Medicaid. And those are 2 separate pieces of criteria that I will talk in detail about. Thank you. I'll highlight them. The third type of Husky C is long-term services and supports. This is the Husky C that if somebody is actively accessing a DDS waiver, like an employment and day support waiver, or a residential waiver, the individual family support or the comprehensive support waiver, you're enrolled in Husky C long-term services and supports, and you'll see the income and asset limits there. This is a separate application. It's a W1 LTC application. So those are the different types of Husky C, the general rules, and how you access them. Somebody could also access Community First Choice through Husky A or D. Husky A has low income limits only, and an individual is eligible if they're a parent or caregiver for a child, generally up to the age of 18, or they're pregnant. Husky D is Medicaid for low-income adults who are not on SSI and don't have Medicare. You'll see the caveats there. Also income limits only with no asset limits. And for each of these, you would apply at Access Health CT. And this, for your reference, is from the State Department of Social Services website. It sets forth the different income limits based upon your family size for Husky A and D. So I'm going to recap that. We talked about how Community First Choice is part of Connecticut's Medicaid program, and there's 3 different Medicaid doors that we can go through. And we just talked about the different Husky C doors, the different Husky, the A door, and the Husky D door. So we just talked about, all right, you have to get through one door. You've got to be enrolled in Medicaid. What's next? So the next criteria for Community First Choice is you must be living in a residential setting. Community First Choice. It's talking about how you have to be residing within the community because the community is your first choice, as opposed to living in an institutional, isolated setting where your choice is restricted and you might be more segregated. So you have to meet, the setting has to meet the home and community-based setting rule, and things that meet that, or places that meet that rule, are your personal home, an apartment, a condo. Things that don't meet that criteria are skilled nursing facilities, hospitals, and in many times, high-level group homes, intermediate care facilities. Okay. So there's 4 criteria. You have to be enrolled in Medicaid. You have to be living in a residential setting. And the third criteria is you must be able to self-direct services. And this is a question that Andrew raised. The individual or the individual's representative must be able to self-direct care. So under this program, an individual with the disability is technically the employer, which means they choose their caregivers. They interview, they hire, they determine their hourly wage, they determine what care that person is going to be providing, they determine the hours that the person will be working, and they can fire that individual if they choose to. So you're self-directing all aspects of your care. Now, not everybody is able to self-direct cognitively. An individual may not be able to self-direct their services, in which case they can have a representative do so on their behalf. Now, the regulations for Community First Choice really don't define what a representative, that a representative has to be a formal role. You don't have to be a formal conservator or guardian or power of attorney. You can be a parent, you can be a family member, you could be an advocate, or you could be one of those formally appointed roles, such as a guardian or a conservator. So that individual representative can basically say, I'm going to self-direct on this individual's behalf. An important point here, though, is that the representative, the person managing the caregivers and support, can't be a paid caregiver under the budget because it's a conflict of interest. The person that's choosing and managing can't also be the person chosen and managed. So there's a point here, which is that if there's an adult, so age 18 or older, and a parent is providing supports, and the individual is awarded a budget through Community First Choice, that parent could be a paid caregiver. However, if the parent is a guardian, there's a conflict of interest there. So in some cases, I've had parents that one of them serves as the guardian so that the other, who may be a backup, can be paid as a caregiver. That's just something important to keep in mind, and that really depends upon the family structure and if the parent is even being considered as one of the potential caregivers.
And Kathleen, really quick question. I just want to, or two questions and a comment. So one is a sibling can be a caregiver. The other was, will you be giving a copy of the PowerPoint presentation? And I just want to ask that because that may allow people to either take less notes or more notes. And lastly, I just want to confirm, and this might help with some clarification, and that is the idea here is for people who might need a lot more care, this funding is so that they can really be the very definition of self-empowerment, right? Really be able to, you know, be as independent as possible, be able to hire their own people, you know, really is, again, self-empowerment as you can get as an alternative to being in an institution. So that's what's really great about Community First Choice.
Yes, absolutely.
I know you've said that. I'm just reiterating.
No, I think it's a great point to underscore, and that's why self-directing services there is a presumption that the individual can self-direct, though it's not a requirement. And I think part of that is to underscore the empowerment piece. Yes, I will be sharing the PowerPoint. So, and of course, also available for questions after. So, you know, if there's things that are burning or you're scribbling down notes, you can slow down a little bit. I believe this is all, is this being recorded? Yes, this is also being recorded. Okay, so the fourth criteria. So we're at the last one. So the first one is that you've got to be enrolled in Medicaid, Husky A, C, or D. Find your door. Once you get through your door, you're golden. You've got Medicaid. Second is that you have to be living in a community-based setting. Third is that you or someone on your behalf must be willing to self-direct services. And fourth is that the individual must require an institutional level of care. So an institutional level of care is typically defined as somebody that needs assistance with 2 to 3 activities of daily living, such as bathing, dressing, toileting, transferring, eating. They're all there on the screen. But in addition, and this is really important because this is something that Community First Choice, the program itself and the way that it's been administered in our state, we've kind of waffled on it, is that you can access Community First Choice even if you don't need that hands-on support, but you need support with independent activities of daily living, such as meal preparation, managing money, shopping, performing household chores, using a phone, many of the things that individuals with intellectual disabilities would benefit from support with. In fact, as you see starred here, if you are deemed to be eligible for DDS services, you automatically meet this fourth criteria of requiring an institutional level of care. Now, just because you meet the institutional level of care doesn't mean that you have unmet service needs that will guarantee you a budget. So I'm actually going to go to the next slide. So you might meet all 4 criteria, in which case you should apply for Community First Choice no matter what. The next question is, okay, so you meet the criteria. Now, what can you get? How much money can be awarded to you? So to continue this conversation about the institutional level of care, an individual must have an unmet service need. And this is critically important, especially for people that are receiving any form of DDS funding already. The premise is that when somebody receives any sort of services, they receive a budget for DDS or community first choice, there's a presumption that all of the individual service needs are met. Now, that presumption practically is not always true. And so what's incumbent upon the individual is to demonstrate that you require more services. And you must specifically be able to identify those areas of unmet service needs, meaning where and how do you require more support? Think about DDS funding and community first choice funding as all being part of one big pot. We talked about community first choice being part of Connecticut's Medicaid program. Likewise, if somebody's receiving DDS services through a waiver program, that waiver is a Medicaid program. So community first choice funding dollars and DDS funding dollars are all coming from a Medicaid bucket. So there's no double dipping, which means that if you have a DDS budget that's awarded, we're going to start, or the state's going to start with a presumption that that budget is enough. But you as an applicant, as an individual or family member might say, you know what, this budget is not enough. I still have unmet service needs, in which case you can and should apply for community first choice as an additional source of funding to meet those unmet needs. But it is important to understand that there will be offsets to the extent that community first choice might say, you've maxed out the DDS funding is sufficient to meet all of your needs. So we're not going to award a community first choice budget. That is possible. However, it's also possible that you qualify for both. And so the takeaway for anybody thinking, I wonder if I qualify or not, or I wonder if I would get a budget, apply. There is absolutely no harm in applying and seeing. And even if you're denied services, you have appeal rights. You can go to a fair hearing and appeal. You can also reapply at a later time, particularly if you have a change in circumstances that would then create an unmet service need. And I'm going to go into some examples of CFC in action.
And Kathleen,
Yes.
just really quick, there seem to be a few questions, and if we could just reiterate a little bit on who can be a caregiver, right? You know, there's a sibling, there's a question of Social Security, and there is no waiting list at all. That's something we'll get to, but sorry, I just saw that pop up. But just again, how is someone, you know, a caregiver? And if you could explain, you know, the double dipping, and it's not so much necessarily a parent. My understanding is that if you can control the money, you can't control it to go to yourself, is I think a general, maybe overly simplistic way to say it. And somebody did ask a minimum wage, but if you could just elaborate a little bit more on, there seems to be some confusion on who can be a caregiver, a staff, a sibling, guardian.
Yes. So the answer is that for an adult, a parent can be a caregiver. A parent cannot be a caregiver, a hired caregiver of a minor, because there's natural parenting responsibilities that the law sees to conflict. So a parent of an adult, really any individual. So it's a self-hire program. You can have a neighbor, you can have a sibling, you can have a friend, not a spouse. I believe there's restrictions on spouses. So really,
and minimum age to apply.
Yes, there is, which is a good, I would have to double check. It's either 16 or 18. I think it's 18, but I'm not positive. So, and I can get back to whomever if they want me to answer that question offline. But the idea is that the person, you can really hire virtually anybody as long as that person that you're hiring doesn't have some other responsibility to that individual legally. And I think that's where the concern is, that there can't be a conflict of interest, meaning that a guardian can't also be a paid caregiver because there might be a conflict of interest. An agent under a power of attorney technically can't be a paid caregiver because there might be a conflict of interest. So that's the general rule of thumb. The no double dipping concept is that when an individual requires any sort of supports and turns to the state of Connecticut to say, what programs do you have that I can access? There's different programs out there. There's Community First Choice, there's the DDS programs, there's an autism waiver, and an individual might think, oh, I'm accessing 3 different things, or I'm accessing 2 different things. I'm accessing DDS and I'm accessing Community First Choice. But underlying those supports, the payer source is all Medicaid. So when you pour Medicaid money into your glass, the glass only goes so high. So there's only so many Medicaid dollars available to one person. And so all the Medicaid money, think about whatever program you're receiving, it's all the same dollars. They're all coming from the same place. So if you're getting funding from one source, it may cancel out or reduce what's available from another source. All right, so some examples of Community First Choice in action. First, we'll talk about someone with a need for hands-on support. Amanda is totally dependent for nearly all of her activities of daily living, meaning she needs somebody to help her shower, dress, use the bathroom, get up from a chair to standing. She doesn't have any residential budget through DDS. She doesn't have any other Medicaid services and supports. She applies for Community First Choice. Her application is granted. She's already enrolled in Medicaid. She meets all of the other eligibility criteria, and she's awarded a budget based on her level of need. And I'll put a little asterisk here. I will talk about the level of need assessment in a couple of slides. And she's able then to hire and manage her own personal caregivers. Another example of Community First Choice in action is a change in caregiver status. Gilroy lives at home with his father and goes to a day program through DDS. His father does all of the housework, cooking, cleaning, shopping, budgeting. Gilroy's father becomes very ill, and he's no longer able to help manage the household. So Gilroy may be eligible for Community First Choice as long as the state determines that his father's illness has created now an unmet service need. So previously, Gilroy's dad was covering all of these other things that Gilroy needed for support. Because of his change in health, applying for Community First Choice, he can access those services. It appears that Kelly Dorsey might be drawing on the slide. I'm not sure if other people can see that. A residential transition. Samantha has a minimal DDS residential budget. She has obtained a housing subsidy for an apartment, and she's going to be transitioning out of her family home. Samantha may now be eligible for Community First Choice so that she can self-hire and self-direct in-home supports, because moving is now creating an unmet service need. This is really critical, and this is part of bypassing a waiting list. For example, there may not be residential funding. It says Samantha has a minimal residential budget. She may not have a budget at all through DDS for residential services. But because she's moving, there's a change in circumstances where if her parents or other individuals in the family home were providing natural supports, she's now going into a situation where she doesn't have those supports. So she has many unmet service needs that Community First Choice can address for her. 2 more examples. One is simply one of combining resources. So if Fred has a DDS budget, he can self-direct those services. Andy has a community first choice budget, no DDS residential budget. Fred and Andy can move in together as roommates. And because they're both self-directing their supports, they can hire the same support staff and pay that support staff through their different budgets that they're self-directing. It is important here to note that you have to be self-directing. That's a key to make the community first choice dollars and those DDS residential dollars work in harmony with the same support staff. And lastly, portability of funding. This is just a general concept that I was speaking with one of the individuals, Carrie Fillick, who helps administer community first choice. And she brought this up as an example, and I thought it was useful just to make sure everyone's aware of these options. That Gina has an approved day program budget through DDS, but she hasn't been able to attend the day program due to illness. So she feels like she's at home, not accessing that DDS budget. So she applied for community first choice, and they said to her, there's this concept called double dipping, and you already have a day program budget. So there's no more money available to you. Gina's reply was, well, I can't use that money. And so the concept here is, yes, she can if she exercises what's known as portability, which means that instead of using your day program budget and hiring an agency or an organization to provide a day program, that she can self-direct that budget, meaning that she could actually use that budget while she's at home to pay for and provide in-home supports.
Kathleen, your
She may
microphone's
also
been very
still be
loud.
eligible for community first choice dollars if she hasn't maxed out on that DDS budget once she exercises the portability. So how does one apply for community first choice? I can't say it enough. First, somebody has to apply for or already be enrolled in Medicaid. So we talked about that as the first criteria, but it's important not to forget that this is a Medicaid program and you need to be enrolled in Medicaid to access it. The second criteria is a much simpler application process. You go to this website, ctmfp.com, or you call 211, and there is a community first choice functional application. And this essentially operates like a screening tool where it will ask the individual questions about, do you need assistance with different activities of daily living? Are you dependent for these activities? It's a rating screening scale. Once the screening tool is submitted, they'll determine whether somebody appears to be functionally eligible for Medicaid. Remember, I said that if somebody's already enrolled in DDS services, you still have to complete this application, but you're already proven that you're functionally eligible. You've already passed the screening tool.
Kathleen, the
But
microphone
that's how you get the ball
very
rolling.
loud.
So
Can
then what
you
happens?
Back up a little. Or...
Well, first the individual is assessed. So somebody is going to come out, or I think right now they're doing these visits, I believe through telemedicine, where there is an initial assessment, and that assessment can look a little bit different for everybody. There's what's known as a universal assessment through community first choice, which is a set of many questions, interviewing essentially the individual or interviewing other individuals that can help to speak on that person's behalf to the extent needed about what the individual requires in terms of support with activities of daily living and independent activities of daily living. This might be a more streamlined process for individuals that are enrolled in DDS because there is an interface between with Community First Choice where they actually have access to the DDS assessment records. And so with all those assessment tools for level of need that individuals complete for DDS services, that may answer many of the questions in a Community First Choice assessment. That was news to me. I just learned that when speaking with Carrie. So that was an interesting tidbit, which might change the assessment process for individuals. Based on the assessment, there is a level of need score that comes out, and it's not exactly the same level of need scaling tool as it is with DDS, where you've got 1 through 8, although it is a scale of 1 through 8. But it's based upon your level of need. You're allocated a budget. Different levels of need garner different budgets. Now, technically speaking, under the Community First Choice program, there's no cost cap, which means that you can never reach a ceiling of funding for Community First Choice. If your needs are extreme, Community First Choice is supposed to step in with a budget that meets your extreme needs. Now, I say technically because I haven't met a client or an individual in a position where I've had to actually see that ceiling move. But that is what the law says, and it's important to know that if your needs are excessive, that is what you're technically entitled to under the law, is no cost cap. That doesn't mean you can double dip, though. Remember, we always have to be aware that there's only so many Medicaid dollars that are available, and other programs like DDS programs do have cost caps. Then a service plan is developed where you, as the employer of record, the person with the disability, or your representative, says, okay, here's my budget, and let's say it's $50,000. I'm going to hire 3 people, and I'm going to have them work 7 days a week for a couple hours a day. And you build out your plan in terms of how many caregivers and the hours they're going to work and what they're going to do. That service plan is then approved by the Department of Social Services. And I do want to add here that there's an option to hire a support broker, which is somebody that will help you to develop that service plan. The service plan is then approved by the Department of Social Services, and it's transmitted to the FI, which stands for Fiscal Intermediary. So this program doesn't work in the way that many people hope, which is that you get a check in the mail for $50,000 and you can use it however you choose under your service plan. The money is actually held onto and managed by the fiscal intermediary, and that's Allied. Individuals that are served through DDS, their fiscal intermediary is Sunset Shores. And when I was speaking with Carrie, as I mentioned, who helps administer this program, she said that if somebody's receiving and working with Sunset Shores and they get a DDS budget, that they may totally have to switch from Sunset Shores as a fiscal intermediary.
Kathleen, can you bring your volume down a little bit?
Wasn't
it's like
able
really
to
loud.
totally confirm that as to whether you have to leave Sunset Shores altogether, but she was virtually convinced that that was the case. So that's just something to be aware of. There is an interface between Sunset Shores and Allied to make that a smooth transition. Then there's an employer training, and let me back up for a moment as well. If you don't know who you want to hire, Allied has a list of individuals that have basically been approved as potential caregivers through the Community First Choice program. So you can request that list and call those individuals and begin interviewing them to see if they'd be a good fit. There's a background check. There's a training to make sure that the individual understands the rules of employment. It's also important to know that through Allied, the individual caregivers do have workers' compensation insurance that's not taken out of somebody's budget. That's just a default for everybody. So that's important to know that you're protected. And Allied will do the payroll. They'll work on all the payroll back office type of things. So you as the employer, the individual with a disability or the representative, will then submit the employee applications to the state. The employee will be officially hired and they'll start working. When they work, they will complete timesheets, and those timesheets will be provided to the individual to sign off on and then submitted to Allied, the fiscal intermediary, and Allied will then pay the employee. And I believe it's a bi-weekly basis. Carrie did want me to mention that there's a new system coming out. I think it's EVV, I forget, it's electronic visitation verification, I believe. It's a new Medicaid system for tracking time. And she said that there's a pilot program, so some people might already be affected by this, but basically it's shifting this reporting of signing off on timesheets to an online platform. That's just something that may come up down the line. Community first choice budgets, I mentioned that there's a level of need, and this is a byproduct of that community first choice assessment. And this is just an approximation of the PCA hours, caregiver hours per week that a level of need will garner. When you're allocated a budget, there also is no requirement that you pay a certain wage. So you do have flexibility to determine how much you're going to pay a caregiver, which may give you a little bit more flexibility or less flexibility in terms of the PCA hours. So I'm going to wrap up and say Community First Choice is a program for people that are enrolled in Medicaid Husky A, C, or D, who are living in a community-based setting, who are able to self-direct services or have an individual self-direct on their behalf, who meet the level of care requirement. And once somebody meets that criteria, they're then assessed to see what their true level of need is and what the budget would be that's allocated to them. They then have the ability to self-hire and self-direct their caregiving services. So I thank you, and at this time, welcome any questions.
Hi, Kathleen. So a question was asked earlier.
Battery, 60%. Connected to.
Whether, what happens in the case that your needs change with CFC?
I'm sorry, Wayne, I couldn't hear you for a moment. Could you repeat that, please?
The question was asked, what happens if your needs change while you're on CFC and you need to change your program? Can you do that? Is there a mechanism?
Yes, that's a great question. I'm going to stop the screen share for now because I will make this available. Yes, so what you can do when an individual is assessed, they're assessed by Connecticut Community Care, CCC, and you have a case manager assigned through CCC, and you can contact that care manager at any time if there's a change in service needs, and they will be required to reassess at that point in time, can make adjustment to budget accordingly.
Okay. Another question that was asked is if you apply for CFC and get turned down for some reason and think that that was wrong, can you appeal it? And if so, what's that process? And then also, how long do you have to wait to reapply if you were turned down?
So the appeal period the appeal process is what's known as a fair hearing. And that's an administrative hearing through the Connecticut Department of Social Services, where there's a hearing officer who is assigned, and that hearing officer is determining whether or not the decision was appropriate. So you can go individually, you can hire your own attorney to represent you, and the state likewise will have a representative to assert the state's position as to why the individual was denied. And the hearing officer is ultimately going to make the decision. And of note, it's important to know that you could be granted a budget, but you might not think it's a large enough budget. So you don't have to be outright denied in order to appeal. Any decision that you think is adverse or incorrect, you can appeal. If you lose a fair hearing, you also then have the right to appeal that to Superior Court. There's no waiting period requirement in terms of when you can reapply to Community First Choice.
Okay, thank you.
You're welcome.
Can you use Community First Choice money for medical needs? Is that part of the budget, or is that over and above the budget?
Can you give me an example of what medical needs?
Let me, somebody asked the question and there were a bunch of acronyms in it, and I'm having a hard time finding it on the chat, but I remember it going by. Different types of therapies and things like that.
So there are additional related services through Community First Choice, such as occupational therapy and physical therapy.
Yeah.
I'm just going, I have a note on that, I believe. And I also talked about being able to have home modifications and things like that. I believe that's part of the assessment process. And
Okay.
I'm going to say again, there's a little bit of a caveat here, which is that there's been a lot of shifts in Community First Choice since it first came out, and what is technically set forth in the state plan or the federal law might not always be provided to the extent anticipated based upon just the state not having the resources or the personnel in place. So at least as of a couple of years ago, I know that although those related therapies like OT and PT were technically part of the Community First Choice plan, that they didn't have a lot of OTs and PTs to provide those services. So there's kind of the practical application of the program, and then there's what technically should be there. So I'm not sure where we stand right now as a state. That was a couple of years ago. So those therapies may well be integrated into the program. And those are separate and apart from the budget. They're in addition to the budget.
Okay, thank you for that. Can people use Community First Choice money to make modifications to their residence or vehicle mods or things like that? Or, you know, capital expenditures, renovations?
Yes, as to home modifications, that is in addition to the allocated budget, and I believe it's a $15,000 one-time resource that's available to an individual. I don't believe that you can do vehicle modifications. I'm not positive, and I think the thinking is that you're making the home more accessible, but it's certainly worth asking.
That's great. We covered no waiting list.
Yes, and just on that point, Wynn, there's technically no waiting list, which is wonderful. There may be some practical wait periods for an assessment, and that depends upon where you are in the state and where the state is in the process. There was a point in time where we were significantly backlogged and people were waiting months and months and months to be assessed. I believe that we've kind of caught up with the demand.
Okay. And just to be clear, people can hire basically whomever they want to support them using CFC.
Yes.
Is there training requirements for the people that are hired?
I don't believe so, beyond your individual training requirements for that individual. In terms of what your care needs are and how to meet them. But I don't think that there's minimum criteria of you have to have a certain certification or pass a certain care course, as there might be to work for an agency that's providing services. I know there's a background check. You have to meet the ultimate criteria of allied.
Okay, yeah, the fiscal agent. Is there a regular review period? Are there annual or semi-annual touch points with a representative of DSS? Or
Yes, so a budget is typically allocated on an annualized basis. So at the end of that year, there will be a reassessment to determine whether the budget will remain the same or increase, or even in some cases for individuals, it's decreased. So it's important to always make sure that you're still demonstrating that you're using the budget that's allocated to you.
And you may have covered it in the presentation. How frequently is the person participating in CFC speaking with the fiscal intermediary?
Well, so the individual participating is the employer of record unless there's a representative working on their behalf, and you're submitting timesheets to the fiscal intermediary. So I believe every week or 2 weeks you're submitting those timesheets.
Yeah. So one person asks, you could hire and pay your neighbor if that worked for you.
Yes. Yeah, and one of the things people love about this program, which is great, is that in many cases, people already have those people that they're paying to provide supports, or that are just providing them uncompensated. So it's a nice way to say, you don't have to change anything that you're doing. We're just going to change how the person's being compensated.
Okay. Oh my gosh. Okay, you've got a lot of requests for this presentation to be sent to people. So.
Okay, so I will send it to Shannon, I suppose, and she can disseminate it.
Yep, and if it's all right with you, we will just also post it on the ARC website.
Yes, perfect.
Okay. Any other questions? Please put them in the chat.
I think I saw one roll in at one point about how COVID is affecting this process, and it's simply that I believe that there are telemedicine assessments at this point in time. An assessment for community first choice is not a physical assessment, it's an interview of questions. So that's something that's able to be done remotely. I see someone says, does a person need to have a certain IQ to apply or be approved for community first choice? No, you don't. The functional criteria for community first choice is that you meet the institutional level of care. If you qualify for DDS services, then you naturally do meet that level of care, but there's no intellectual requirement there. Anecdotally, that's one of the things that is very appealing to community first choice to many individuals, is that the focus, so for example, the focus of different Medicaid programs is very disability specific. So there's an acquired brain injury program, and there are DDS programs, and there are mental health programs. And so what community first choice does is it says it doesn't matter how you get there. It doesn't matter what causes the need. What matters is the need. And so community first choice just says, do you have a need? Do you have a need for care? We don't care how you get there.
If you're having do you get assigned a particular contact person at DSS during the application process? Because people are voicing some inability to communicate to find out where they stand in the application process. How do you do that?
Okay, so this is one of the practical challenges of the program. So what I'll say is, what becomes tricky is, once again, you have to be enrolled in Medicaid and submit a separate application for community first choice. So some people are coming to community first choice and applying, and they're already on Medicaid. That's pretty straightforward, because at that point in time, you're already enrolled in Medicaid. Where it becomes more challenging is when you're applying for Medicaid for the purposes of accessing community first choice. So what you need to do is, when you submit the functional application for community first choice, which is calling 211, or when you go to that ctmfp.com, that you, if there's a way to chat or comment or talk to somebody, let them know that you've submitted an application for Medicaid to access community first choice. And on the Medicaid application that you submit, right on the top, applied for community first choice. Sometimes all of that doesn't always work, in which case I call Carrie Philick, who has said to me and to attorneys in the past, if you're submitting these applications, feel free to send me a copy and let me know, because sometimes they just get lost in the shuffle because they're being processed by individuals that aren't used to the community first choice program, so don't always know how to process the application correctly. So I guess what I would say is Carrie Philick, I believe her email is on the state government website. So I would notify her if you're having difficulty, or someone can reach out to me and I can connect you with Carrie.
If somebody ends up moving to Connecticut to possibly come back to family during these pandemic times, can that and they would otherwise be eligible for CFC, can they apply? Do they have to be in Connecticut for a long period of time? Can they apply for CFC?
You have to be a resident in order to be enrolled in Medicaid. Which is, so you have to be enrolled in Medicaid. And I think that might be where people, where the question wouldn't lie. I don't believe that for Medicaid, as long as you reside here with an intent to remain here, at least for a period of time, you're a resident, that you can apply for Medicaid for so long as you're here and access the program.
Okay, thank you for that. And in addition and connected to that, what is the criteria for residency in Connecticut? I know with respect to benefits in Massachusetts, it's 6 months of residency.
I don't know the answer to that off the top of my head. I can get that answer though and email you when.
Yeah, okay, or we could post it as a note to the thing on the website.
Yes. I want to say that my gut is telling me there isn't that minimum requirement, because I know individuals can, for example, transition services to Connecticut automatically from another state, but I will look into that to confirm.
Okay, can somebody use a home care agency that accepts Medicaid to find an employee for them?
It's a great question. So I'm going to say it depends on the agency, and it depends on how flexible they are with their policies. So this is a problem with community first choice that I've run into, and I have met agencies that have absolved the problem for me. So for example, I have a client that has that resides at home and has a community first choice budget, and she was privately paying a caregiver through a home health agency and was running out of money very quickly. And she has a live-in caregiver that was an employee of this home health agency. And in order to preserve the funding, private resources that were rapidly being depleted, we applied for community first choice, but the home health agency had to agree to basically allow that employee to work for and be employed through community first choice, because essentially that home health agency is giving up their employee because they're not on the agency's payroll for the hours that they're providing services to that individual, which means that the hourly rate, of course, that you privately pay, not all of it goes to the individual. A good portion of it goes to the company for their overhead and other expenses. So many companies aren't willing to just say, you can hire this person because they're no longer being compensated. And I think that a lot of agencies become concerned that their employees are now going to see this as a separate employment opportunity and leave the agency altogether. Like I said, this has been a problem of the program is the reticency of agencies to be able to accommodate the program. But I think part of the Community First Choice program that if there was the ability to hire someone through an agency, the really out. Allied has to be the fiscal intermediary, but an agency is otherwise serving that role. We as a state, I think, should try to aim for a place where there's a hybrid where somebody can hire an agency and still access the program.
It was asked, do you recommend if the minimum age requirement is 18, can you apply 6 months ahead of time for it, or do you have to be 18 upon application? And in general, what's the waiting time for application turnaround?
So the age 18 requirement was a requirement to be a care provider. As an individual applying, there is no age requirement. There's no minimum and there's no maximum age.
And do you have any sense of the turnaround time?
In terms of when you submit, so part of it depends on whether you're already enrolled in Medicaid, and it does depend on the area of the state that you're in. I'm trying to think about what I've seen. I've seen about a month to 2 months before an assessment more recently. Once you're assessed, things can pretty quickly. If you know, essentially, if you know who you want to hire in advance, then you can kind of move quickly in terms of saying, okay, here's my budget. I already know who I'm hiring. These are the hours I want them to work. And then you can move quickly with the employment process.
Okay. Another question about what the money can be used
I've lost
for.
my audio.
Battery, 60%.
Just one moment.
Connected to.
No, now you're muted.
Oh.
Now I can hear you.
Uh-oh. Oh, good. I didn't know how to solve that one.
Can you use CFC money to buy a whole house generator if the individual needs electricity for daily living?
I don't, if you can classify that as a modification, maybe, but my sense is that might not meet the modification criteria, but it's always worth asking.
Yes, it's always worth asking. Exactly. There's also a question about whether you could use it to buy a house or maintenance and upkeep on a house.
If you can classify the maintenance and upkeep as modification, then maybe, I mean, what you're typically looking at is making a bathroom accessible or putting in a ramp or adding a Hoyer lift. Other than that, it wouldn't cover things like cosmetic changes or things that wouldn't help to facilitate the independence of the individual.
Okay, or cleaning or anything like that.
Correct.
Okay. Can CFC funds be used for out-of-home respite?
That's an interesting question, because I think that the threshold issue that you might run into in that case is demonstrating the unmet service need. So
Yeah.
if what you need the CFC for is respite, they might determine that from a day-to-day basis, you don't qualify for the budget. But if you have a budget, you can use it for respite. It's just that threshold issue of, do you have an unmet need?
Okay. All right. Does anybody have a question that's unanswered? Oh, this is a good question, actually. Is there a minimum budget that they award, or is it completely based on need from 0 on up, or is there a minimum amount?
I don't know what the lowest threshold is. I mean, the lowest threshold is they can say you're not eligible, but I don't know. I do know that at one point I had some sort of fee schedule that basically said if you're a level of need 1, this is your budget 2, and that might still exist. Generally speaking, I think that the top budget for someone that doesn't have another support provider is usually around $70,000, I believe.
Correct.
However, I say that with the caveat that Community First Choice doesn't have a cost cap per se, so if your needs exceeded that, you should have the ability to request that additional funding.
I think that there have been a lot of questions about sort of modifications and capital improvements and things like that. Is it one listener is one meeting participant is asking, isn't this though mostly for caregiving, mostly for support?
Yes, so when we talk about a budget through Community First Choice, we're strictly talking about caregiving and in-home supports. The home modification questions refer to something that's additional in Community First Choice, which is that in addition to the budget, you can also have further funding allocated for home modifications or even other therapeutic supports like OT and PT.
Okay, that's good clarification. So the last question in line with that is, can it be used for housing? I think, you're implying that it can be used to be supported inside housing, but it can't be really used for rent.
That's correct. Yes. So it doesn't pay, it only pays for care or for supports. It doesn't pay for your rent, doesn't pay your utility bills. But the goal is to maximize all your public benefit resources. So make sure you're applying for rental subsidies and make sure that you're applying for Social Security and other cash subsidies that can help to offset that rent so that you can afford the housing, and then once you're there, Community First Choice would provide a budget for your supports.
And applying for those other things that you mentioned can be done in that same 211 portal.
That's correct, yes. Yes, another just tip and aside, if someone's looking in general to be eligible for a rental subsidy, I always say contact your town because towns often have different applications and maybe even different options for individuals with disabilities for subsidies. And then also, if you go on the United Way, which I believe is the 211 website, you can subscribe for email updates for residential housing subsidies. So a housing subsidy in general is a voucher that will pay your rent so that you're paying about 30% of your income toward rent and the remainder is covered by the subsidy. And some subsidies are linked to particular places, particular apartment complexes or particular homes, and others are what are known as portable, meaning that if you're awarded the subsidy, you can take it with you wherever you go. It's a really important thing to be aware of, and there's waiting lists for subsidies, sometimes up to 2 years. So when you apply and subscribe to this United Way website, it will tell you, for example, the Bristol Public Housing Authority has an opening where you can go in and submit an application. And then at that point in time, there might be a waiting period of 2 years. So you have to wait for the housing waiting list to open and then apply to be on the waiting list to get a subsidy. But this can be a great program because you can in advance, as part of a housing plan, say that you're going to, if you want to move out in 2 years, start applying for subsidies. And then in 2 years, when one becomes available, apply for community first choice to get funding to pay for your in-home supports.
Okay, I'd like to say thank you very much to Kathleen Hayes. This has been very informative. I've gotten a lot of notes from the
Good.
participants that have had to leave for other things, that it's been really great. So I think right now
Good.
we're gonna close down the meeting. We will send each of the people that came tonight the PowerPoint. We'll also have it up on the ARC website for everybody. And I want to thank everybody for their participation tonight. Stay healthy.
Yes, thank you for having me, and I'll answer those questions so you can post them on the website as well.
Great. Thank you, Kathleen.
All right. Good night, everybody. Thank you.
Good night, everybody.